Victoria's government has handed down its budget and it promises to spend big on mental health. Big businesses will be hit with a levy to raise $843 million for mental health and wellbeing services each year. To discuss this, we're joined now by Betty Chetcuti, a psychologist and director of the Australian Association of Psychologists. Thank you so much for your time. What do you make of this proposal?
Good evening, Karina. Look, we're really positive about Victoria taking the lead in terms of further supporting mental health, but we'd really like to have a lot more detail around the role of, additional support for psychologists so that they can maintain their access for their clients.
How desperately is this money needed?
It's beyond desperate. We've been talking about it for a good while. It's really unfortunate that we're not all quite on the same page. We have clients who, they're on waiting lists for up to 18 months. It's unacceptable. You don't need to be sick enough or suicidal enough. We're really tired of hearing these stories. We are, as professionals, also really tired of seeing the government talking about supporting mental health and supporting hubs, but we're really needing the money to go to psychologists who are seeing their clients right now and to be able to, give them more rebates so that they can continue their access. I have clients who've finished their 20 sessions, and I'm really kind of wondering what the government expects me to do with those clients. Is that something that they're expecting psychologists to continue funding on their own back, or is it something that the government can follow some of the initiatives from the Productivity Commission, which was to have for up to 40 sessions? Now, 40 sessions hasn't been talked about, telehealth hasn't been talked about, and the increased rebate hasn't been talked about. So it's kind of concerning. It's beyond concerning.
We'll come to the Commonwealth and what the federal government is doing in a moment, because I do want to ask you a bit more about telehealth and expanding of those Medicare subsidised sessions. But let's just stick with what the Victorian government has promised here. Do you have any issues with the mechanism that's going to be used to raise these funds, a levy through payroll tax on big business?
Well, in terms of big business, I think that as a community, there's a lot of conversation around how can we all help each other. And I think that we're in such a crisis that it's a really innovative approach that we're all banding together. And I think it is up to the community as well to look out for one another as citizens of our space.
Well, because I ask that because business mainly on the whole wants payroll tax abolished, and here we are seeing Victoria increasing it for some of the biggest companies.
Mm-hmm. Yeah, so in terms of the payroll tax, my economics background goes so far. My focus is really on mental health, and it's really innovative once again that business is being called upon to support mental health in Victoria. And, we have been really hard hit with the restrictions, and I'm seeing clients and friends of mine, people that I know, going into facilities, and it's just really sad. And all that we want to do as a profession is help these people and increase the access.
Yeah, and what are you seeing in terms of that ongoing lasting impact from last year's extended lockdown in Melbourne?
Yeah, we're seeing some kind of emerging conditions. So people that as they were going through the lockdown, they had one set of symptoms, but now we're seeing some longer lasting impacts in terms of people really being unable to cope, and the strategies they were using to cope because they were unable to get access. It all comes down to access. Their symptoms have escalated, and now they're in psychiatric facilities, unable to get out, being medicated. Their friends are contacting them. They're not recognisable, and it's a strong concern for their family and their friends. We have people who are just in despair. They've fallen into depression again. I've had clients who I've seen 2-3 years ago, and they've been coping quite well. COVID has hit, and isolation has come with that, and their depression has spiked again. And they can't have access. And then with telehealth only being extended for 6 months, it's really concerning, and we're just not sure why we're not all on the same page. Community is expected to pull together, and psychologists in our business, but we really need government to put the money where the Royal Commissions and the Productivity Commissions are advocating, which is towards increasing the services directly to private practicing psychologists.
Okay, so let's talk about telehealth, and that comes from the federal government. That we've spoken about it before, has been such a godsend for so many people. But there are only so many psychologists, aren't there? And there's an increasing group of people who are trying to access these services. So is extending telehealth a solution?
Yes, it is a solution, because what happens is the people that couldn't get the access can now get it, and they get it in a reliable way, and they get it in a way that means that they can access their psychologist in an ongoing manner. Mental health isn't, a 5-session or a 10-session, experience. It's something that is chronic and it's complex and it's severe for some people. Other people have, crises and episodes in their life that they are responding to, and psychologists are the best, and they're the experts in terms of treating these complex and severe chronic mental health conditions, and also for people who have those episodic experiences in terms of, there's a grief in the family, or, there's a change in their family in other ways. So we're really calling on the government to expand the provision also and the deployment of services such as provisional psychologists. We've talked about this before. This week, we could have 125,000 more appointments being made available. We have people in despair crying that their loved ones aren't able to see clients. We have university courses being culled because the diversity within the profession is being honed in, and we really need to expand that so that we can have the richness of our profession back again, so we can continue to do the work that we want to for our Australian public. So
the capacity is there for another 125,000 appointments a week?
Yeah, absolutely. So these psychologists are at the last leg of their training, and part of that includes heavy supervision by what's called a board-approved supervisor, and they're board-approved by the regulator, APRA, and there's absolutely no reason why they can't be deployed to be seeing psychologists. They have got 4 to 5 years of training. It's high-quality training at university level, and they can be made available. We've been asking for that. We've been asking for the rebate to be increased. Now, the reason why that increase in rebate is important is because clients can't afford a professional service fee, and the rebate from the government helps the client to be able to support their contact with their psychologist. It's either that or the government's asking psychologists to take a hike in their pay.
Betty Chetcuti, always good to talk the issues through with you. Thank you so much for taking the time to speak to us.
Thank you very much, Karina.